Here for Mick to join. He'll be here in 2 seconds. We'll get him in and we'll be talking optometry practice finance during this coronavirus situation here. So let's give him just a second here to join. Once again, for those of you coming from Facebook, apologies that we couldn't get it done there. Technology will bite you sometimes. Let's get you in, Mick. He is joining now. Hey, man.
Hey, Matt. How are you?
I'm well. I wish Facebook would have worked. There's a great community over there, obviously, and so
yeah,
not this time.
Well, we'll work with it. So thank you for your patience getting me on. I appreciate it.
Yeah, absolutely. Well, it's great to have you back, and we definitely had quite a lot of people watching last time. Today we're talking again optometry practice finance during this coronavirus pandemic situation. Lots of new things developing every day. I've got CNBC running in the background so we get all sorts of charts going and make it look like we're on the news or something.
Yep, I love it.
But every day, upgrading the studio. We got a cat hanging out there.
I see that. Nice.
Yep.
And you might notice that I'm working on the Matt Geller look right here.
My barber will not let me in. I can't get any haircuts. So
yeah.
We're growing it out. So thanks for joining, and I guess so much has developed recently. How would you like to kick this off? What's kind of on top of mind right now for you when it comes to practice finance, especially maybe development of the new stimulus bill?
Yeah, so it's interesting. You and I sat down, a week ago, maybe 8 days ago, and what's interesting is the evolution of my mindset that's occurred over the last 5 to 7 days about what's been critical. I think looking back, I felt like I went through those 5 stages of grief, and I think now I'm at that stage of acceptance, which is, okay, this is a new reality for all of us. What I've been mostly thinking about lately is not what do we do emergently, because we talked about that last time, and we can certainly go through some of those points again now if we want. But really what I'm thinking about is the next 60 to 90 days, because I think that is going to be where a lot of the pain is felt, primarily because if you depend a lot on insurances and discounted vision plans, like most of us do, there's this delay in revenue that comes in. So as we get back into business, hopefully soon, which is, by the way, a big unknown right now, as we start to ramp up the business, there's going to be a delay in income in our practices. And so I feel like the pinch is going to come in the next 60 to 90 days. And so what I've been working on is a sort of a 120-day survival guide. Like, what do we do over the next 120 days financially to make sure that we've got some limited revenue coming into practice, we've got some potential stimulus money coming in. How do we manage all of that? Because if we get a big stimulus check and we spend it all in month 1, that may create a problem in month 2 or month 3. So that's kind of where my mindset has been over the last 2 or 3 days.
Yeah, no, thank you for that. And I've got some really interesting data here. We're going to be releasing a variety of dashboards for the industry to see. And this is in a partnership with Covalent Careers, our company, and GPN. They have a product called Edge Pro, and it's a practice dashboard thing. And so we've built some proprietary dashboards together to be able to watch the trends happening across roughly just under 3,000 practices. And to your point before about revenue dropping, we're measuring this day by day, and we're going to be releasing these charts on our website. So you'll see them on covalentcareers.com. But it looks like last week, right, we had a full measure week, compared to the previous year, practice payments across this sample of about 3,000 practices were down 25%, which is pretty big. And if we look at just weekly exams, that was down 40%. So across these practices, last year they measured around 160,000 exams that week, right? That week of the year. And last week, this year, we're measuring about 98,000 exams. So a 40% or so decrease there. And so this is live data that we're able to pull and showing that we are not trending. Obviously we're not trending to what we were doing last year because of this massive drop off, but we're starting to see some of these numbers come in. And once again, we will put this out there for everyone to try to understand the impact this is having. Some of the things we'll be measuring on these are weekly exams, new patients, contact lens purchases, frames sold, lens sold, patient payments, things like that. So Nick, this will be great for you to track, and you can see maybe where, what's keeping up and what's really declining.
Yeah, that's fabulous data. I love to hear that. Not happy to hear it, obviously, but love to hear that somebody's doing something. And Binkowitz and Ed Buffington, I know, are great at this kind of stuff. Here's the thing I think we haven't even begun to really touch on, and that is the revenue down by 25%. Initially, when you read that number, I was a little surprised how low that was. But remember, there's this lag in payments, and so
yes.
Last week we were still getting some insurance payments and some receivables that were trickling in. I'm afraid, this week, now that most of us have shuttered our offices, I think that revenue number is going to drop dramatically.
Well, you're right, and the week's not over, so we didn't want to report the number, but I'll give everyone an idea. This time last year, across these 3,000 or so practices, GPN measured roughly 37 million in patient payments. This week, we're only at 3.6 million. So we're down significantly. And yes, we have Thursday, Friday left, but it is not going to come close. So we're going to be looking at quite a large drop. And this is where the proof is there that this is obviously affecting business massively. So yes, right, there's this lagging. It is lagging a bit, and potentially could be worse going forward until some of these quarantine, shelter-in-place orders start opening up, and obviously, this virus starts to part ways with us.
Yeah, think about that. If we do a run rate for the balance of the week, let's just say there are 6 million in collections, and you said there was 37 million previous year. I mean, that's down 80%. That's remarkable. Almost 90%. That's remarkable how dramatic this is going to hit. So I think this receivable number really is telling about what we're going to see in the next 30 to 60 days. And that's really where my focus has been, is modeling a way for us to look at, okay, we have a certain amount of revenue coming in from our practice, assuming we get ramped back up. We have a certain amount of stimulus coming in. What's the most strategic way to use the stimulus money over the next 120 days to make sure that all of our needs get met? And there are variables built into there, because we know that we have variable expenses, which are our cost of goods, our frames, lenses, and contact lenses. But then we have our fixed expenses. And those fixed expenses, maybe some of us got an abatement on our rent, maybe a reduction in our rent, maybe some of us didn't. Maybe some of us furloughed or laid off our employees, and so we don't have any employee expenses right now. Maybe some of us hung on. All those variables in your business are going to impact how you're going to be able to use the cash. And so, as we talked about last week, the most important thing we do right now is preserve cash.
Right.
Just tap the brakes on all the expenses, except for what we defined as those super critical expenses to keeping your business operational, and what I call sort of a moral obligation. And if you maintain those, your outflow of money should be very, very minimal over the next 30 days until we can make some sense about how the stimulus is gonna look. So, but very interesting data. I guess almost like on the way in this morning, I was listening to CNN, and they were talking about how they're just now seeing this big influx of new cases into the hospitals. Mm-hmm. I feel like financially the tidal wave is building for us, and we haven't even begun to feel the financial impact quite yet. By the way, the other thing I was thinking about on the drive-in this morning, I'm sure I'm not the only one that thought about this, but do you realize that a lot of us were planning to be at the Javits Center right now, having a great time, sharing and hugging and educating each other, looking at great new products. And instead, that Javits Center is a 4,000-bed hospital.
Yep.
Is that
posted about that on
mind-boggling?
on Facebook yesterday. It's mind-boggling. Literally at this very moment, it is a giant triage center.
Yeah. So I was at SECO a few weeks ago. I was lecturing there, and I just finished my lecture, and I came out. I'm on the conference advisory board for Expo, and I got a text message from one of the leadership in Expo that said, "Hey, I just want to let you know we just canceled Expo." And I'm like, "What? Cancel
Yep.
Expo? That can't be. What's wrong with this world, right?"
Yeah.
Not realizing that literally a month later, that place would be turning into a makeshift hospital. It's just
Things are
really astounding.
things are certainly happening fast. I really want to get to talking about the stimulus bill that was just passed in Senate, maybe talking about the markets a little bit too. But really quick, is there something that practices can do right now to generate revenue or to just keep afloat? Different practices have set up different things. Maybe some practices years ago prioritized online ordering or made, uh, you know, shipping contacts a lot easier. I mean, what can still keep a practice generating some revenue at the moment?
Yeah, great question. We touched on this a little bit last time, but I think it's worth repeating. Number one is make sure you're getting all the claims out. This is a great time if you have an administrative person that can work from home. Make sure all those outstanding claims get submitted. Sometimes you'll open a drawer and find a stack of claims that forgot to get submitted. Make sure the denied claims are followed up on. Sometimes those get put on the back burner. They get denied, and you sort of forget about them, or you'll get to them later. Collect any outstanding patient balances. I know this can be a touchy, emotional subject for a lot of docs to say, well, I don't feel right going after my patient's money right now. Here's what I want everybody to remember. I had a conversation with my banker earlier this week, and I said, hey, how is the banking industry doing as a whole? And he said, we're doing fine. In fact, a lot of businesses are doing just fine. And it reminded me, and he said, here, the people that are getting crushed are professional services, which are doctors, retail, and bars and restaurants. He said a lot of other industries are doing just fine and having no trouble making their payments. And so it reminded me of my buddy who works for Salesforce, who makes a multiple six-figure income, who works from home, who's doing just fine.
Mm-hmm.
And so I think we have to remember that there's a segment of our population that's actually doing just fine. And I think it's fair to business as usual, if people owe you money, to ask to be paid. Now, do we want to go after bad debt right now? Probably not.
Right.
That might be seen as a little bit heartless. But I do believe the outstanding patient balances we need the cash, and it's fair to ask to be paid what people owe us.
Yep.
Curious about your opinion on that. I know that's a controversial. I've shared that opinion with some other docs, and I've gotten a little pushback.
Well, it seems that everyone's just trying to spread a little, and then we're going to get to this question here from Todd Cohen. It seems that everyone's trying to play fair. It definitely seems as though people are looking out for each other, and so the buck isn't getting passed totally down to Main Street. You're seeing industry companies trying to help by extending payment terms on some of the invoicing that they supplied us, whether it's cost of goods, lenses, whatever it might be. And we may need to do that for patients too, and to help them extend terms. But if we can hopefully widen everything out, it will help so that not one person gets stuck with the bill or all the poor cash flow terms. But I agree with what you said there. Yeah. So this question here.
Yeah, go ahead. I was just going to follow up with that and say that, again, we want to be sensitive about the topic. I don't want to come across as simply pushing our agenda to make sure our patients owe us money. But my only point is that there's a population out there that can and probably willingly will pay their bills just like they normally would. Their income has not been negatively affected. So anyway, let's hear is there another question?
Yeah, this question here was, do we have any idea how the stimulus will work and how much we will have access to? And I've been following this very closely because our company seeks to use the stimulus dollars because it seems as though the terms are going to be very favorable for small businesses. So I'm going to launch into something I'm reading here, and we'll post this on our Coronavirus Resource Center, covalentcareers.com/coronavirus will take you to it. And this is developing by the minute, really, because one, this bill is not yet passed in the House. It's coming up on it. But obviously markets are reacting to the fact over the last 2 days that likely it will get passed and help workers on Main Street and help businesses like ours. But essentially, this bill is going to be called the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. And essentially what it is and how it affects us, excuse me while I scan this here, The Small Business Association is authorized to guarantee up to 349 billion in loans to businesses with not more than 500 employees, or the applicable. Okay. Now, the eligibility evaluations are limited to whether a business, to certain businesses. You had to be operational on or before February 15th, 2020, had employees for whom the borrower paid salaries and payroll taxes or paid independent contractors, and is substantially impacted by public health restrictions related to COVID-19. Eligible borrowers would be required to make a good faith certification that they have been affected, right, and will use the funds, this is the critical part, to retain workers and maintain payroll and other debt obligations. There's no requirement to evaluate the borrower's ability to pay the covered loan, or that the borrower not be able to find credit elsewhere. So the loan amount and purpose here, and once again, this is for all optometry practices here, are applying currently to these standards, unless you just started your practice after February 15th. Eligible borrowers will be able to borrow up to the lesser of 10 million or the business's average total monthly payroll costs during the 1-year period prior to the loan being made, multiplied by 2.5. Payroll costs include salaries, wages, tips, payments for sick leave, insurance premiums, and state and local taxes assessed on the compensation of employees, but does not include the compensation of individual employees' excess annual salary of $100,000 as prorated for the relevant period. The loan proceeds may be used to cover payroll costs, mortgage, rent, utility payments, and other debt obligations incurred prior. Now, it's going on long, but this is the important part here. We're talking about loan, and Mick, I know you don't like debt, right? The unique part is that this loan can be forgiven. And as you're seeing here, the main part of this loan is so that practices don't let people go. As a career development company, as a job board company, all that, we are urging companies to say, yes, Angie, 1099 employees, they do work under this as well. We do not want to let people go because people will be unemployed. They'll stop spending. The economy will go slower. That is what this is all about and why the market's reacting well, because it's helping workers. So there's loan forgiveness here. I'm going to keep reading. Borrowers will be eligible to apply for loan forgiveness equal to the amount spent by the borrower during an 8-week period after the loan closing date on payroll costs, interest, mortgage, what I said before. Principal pay, the amount forgiven is reduced proportionally by any reduction in employees retained compared to the previous year, and by the reduction in pay of any employee beyond 25% of the prior year's compensation. However, reductions in pay for employees who have okay. So what they're saying here is, if you retain your staff, they're going to forgive potentially 100% of this loan. Now, if you watch President Trump's talk last night, which is live streams on YouTube every day, just type in the White House on YouTube, be able to live stream it for free. I forget who was up there. I don't remember the guy's name, some Treasury individual, basically said that applying for this loan will be as easy as walking into your local bank, talking to them about it, and being able to receive it that day. So this is pretty significant and completely unprecedented. And I think that, Mick, I'll pass this back to you based on what you're hearing here. And, granted, this isn't finalized, but a loan that can be 100% forgiven in order to retain payroll, this is this basically free money if you play by the rules?
Yeah, that's what it sounds like. And so last night, that bill did get passed by the Senate, as you said, pretty late last night, into the night. I heard Kevin McCarthy, who's the minority House leader, this morning say that, just to give you guys a little bit of a timeline, that the House would be reviewing the bill today. They're planning to vote tomorrow morning, then debate the bill prior to the vote, but it would be a voice vote. Okay, so, and he said, I think we're going to go through the exercise of debate, but I don't think it's going to materially change the bill. But that makes me nervous when they start debating anything. But he said we will bring it to the House tomorrow, debate it, and then have a voice vote. So in theory, it could pass tomorrow. Last night, Steve Mnuchin, who's is probably who you saw yesterday. I missed that White House. But he's a Treasury Secretary, and he said exactly what you said, which was you'll be able to go to your local bank or your credit union, walk in with evidence of your payroll, and they would be able to issue you a loan on the spot and presumably walk out with a check.
Yep.
That, as you greatly described, could be 100% forgivable.
Unprecedented times.
Unprecedented.
Yep.
The question is, if they give us, I've heard 10 weeks, I've heard 8 weeks, depending. In fact, Mnuchin last night actually said 8 weeks. I heard Marco Rubio mention 10 weeks. If they're using payroll as the determinant for how much you're going to get. Let's say my payroll last month in February was $20,000. They were going to give us 2.5 times that, so that means they would get a check for $50,000. Well, that $50,000 is going to cover 10 weeks worth of payroll, but it's not going to cover mortgage, rent, utilities, and other debt as they described it.
Right.
So one of the big red flags for me is they're basing the amount on payroll.
Yes.
But they're saying that you can use it for anything.
Yeah, that's going to be hard to track what you're using it for. But you can't pay yourself for one of the questions here. If you make more than 100 grand, can't use it for that.
Yes. And you could see a scenario that if you use that $50,000, you could burn through that in 1 month.
Oh, yeah.
And after 1 month, now what are you going to do? You just spent all of your stimulus money. Now, month 2, you're faced with having to make your payroll again. And let's say we haven't fully ramped back up to 100% of revenue. That's why I'm feeling like this 120-day recovery plan needs to be very, very carefully thought out. It's like we're going to have to go on a very strict diet with the stimulus money to make sure that we ease ourselves back in as our income in the practice ramps up.
Yes.
And our utilization of the stimulus money probably needs to ramp down accordingly. So that's what I'm working on. That's where my head is on this this recovery bill. So, but yeah, I think the point is there's a lot of unknowns right now, but it is 100% unprecedented. And to your point, you know how I feel about debt. Free debt is a different story. I like free debt.
Yeah, absolutely. And even if, individuals do need to let go, you can still, it sounds like it's tiered. So if you have a staff of 10 and you let one person go, you do have to pay part of the loan back, but not for some that you retain. Now, one of the individuals here, we'll get to all these questions. What happens if the practice already has laid off employees a week ago? So can they still apply so that these employees could apply for unemployment? Is it better to hire them back and then apply for this loan? It really depends, I think. I don't know if that will work. There is a chance that can work. I would wait for more details. And whoever asked that question, you can pop into covalentcareers.com and talk to our team through chat to figure that out. But you also have to look at what's the other advantage for them, because I also read that those filing for unemployment can receive up to 4 months of 100% of their pay, which is, the stimulus package for individuals who were let go. So it may be honestly better for those people to have that, but it is something you need to juggle. Would it cover my salary, pay myself? If you make more than 100 grand, it sounds like no. You have an S corporation. S corporation won't matter in this case. I'm planning on putting my staff on supplement unemployment as I reduce their hours next week. Should I wait due to the stimulus? Mick, do you want to answer that one?
Yeah, so there are basically 3 things that you can do with your employees. You can terminate them, just let them go and you pay them out anything you owe them as far as vacation. You can lay them off, which, by the way, if you terminate them, they're eligible for unemployment. You can lay them off, and also you will need to pay out their benefits, and they can go on unemployment. Or you can furlough them, which basically means they're technically still employed, and so you don't have to pay out the benefits, but you are reducing their hours. So the question that was presented is the big question that we had, even in my own practice, which is, if we furlough our employees right now, will that somehow disqualify us or make us ineligible for the stimulus loans? And I think that is the big question. So what we chose to do is, we fortunately have the cash reserves to continue to pay our employees. So our people are being paid this week for not coming in. They're all technically still employed. Nobody got furloughed. We ask everybody not to go on unemployment,
Yep.
and we're going to play out this week. Our pay
Yep.
period ends on the 31st, and so I've committed to them through the 31st. I said if we don't have an answer by the 31st and some clarity, we might need to start furloughing. So I think my recommendation would be, if you have the cash resources to keep your folks on board, I would keep them on board and not furlough them yet. If you
Yep.
have no other choice, you're just flat out of money, you may be forced to furlough them. I
Yep.
can't imagine the government would penalize a business for having to furlough their employees and say, no, I'm sorry, that disqualifies you for the stimulus. I cannot imagine. That's
Yeah.
completely against what they're trying to get accomplished here. So but I don't know for us to know
Yep.
right now.
To the question before, I did find in the documentation here about, I'll just read this verbatim. Importantly, borrowers which rehire workers previously laid off from February 15th through April 1st shall not have those numbers counted against them during such period for loan forgiveness purposes, so long as they are rehired by June 30th, 2020. Cancel indebtedness shall not be included in the purchase such amount of the loan from the lender. Any amount forgiven will be reduced in proportion to any reduction in employees retained compared to the prior year and to the reduction in pay of any employees beyond 25% of prior year compensation. Borrowers that rehire workers previously laid off will not be penalized for having reduced payroll at the beginning of the period. So that clearly answers the last one. That's good. You could rehire those people back, but make sure, to Mick's point, this is going to help the payroll. You're only going to get so much loan amount. It's going to be that payroll period, it sounds like, times 2.5, which only covers you for so long. If this continues, they might not do more stimulus, and it may make more sense to have those employees not at your practice at the time, although that is obviously bad for your local community, for those people, and it would urge you, if you have the cash reserves and the ability, to consider rehiring them back. And does this make sense to do this for part-time employees? Someone asks here, is it based on last year's salary? This thing is long. I got to find what it said. Previous year.
I had heard, Matt, that they were going to look at February payroll to sort of as a determinant to what the compensation. I had just heard that. I don't know if that's true or not, but that's one thing that I think I heard Marco Rubio say that in the video that he posted.
You're right. I think you're right. That's what it was. The businesses, it's going to be eligible borrowers will be able to borrow up to the lesser of 10 million, or the business's average total monthly payroll costs during the 1 year period prior to the loan being made, multiplied by 2.5. So it sounds like it's your average from last year times 2.5. So if you if you really grew this year, you may even not have enough to cover, but maybe you were really big last year and then you kind of cut down, you'll get even more.
Yeah.
Does it make sense to do this for part-time employees? Mick, can you take that one?
My understanding, again, this is all sort of speculation just from what I'm reading and what I've heard people say, is that part-time employees are going to be treated the same as full-time employees. So I'm assuming that they will use the same rules for part-time employees. So if you have part-time employees that you want to keep or you feel an obligation to keep, I think that you'll get stimulus money for them. So I would retain them if they're critical to the operation of your business.
Yeah.
If it's somebody that you don't feel like is critical, you just have to make that moral and business judgment whether that's the time to let them go and not bring them back on.
Couple of good questions here. What if I just interviewed an optician and hired her, but she can't start until my doors open again? That's a great question. I think that it doesn't matter that person was on payroll. Once again, I'm going to reread this one section about what the qualifying factors are. Eligible borrowers will be allowed to borrow up to the lesser of 10 million, or the business's average total monthly payroll cost during the 1 year period prior to the loan being made multiplied by 2.5. So they're not worried that, oh, I think Mick's loading here. I'm going to
Yeah.
make sure. Oh, I can still hear you, but you're frozen. Someone in the chat, let us know if you can still hear us. If not, we will just restart the feed. I think you're back. Mick, no, you lost your audio again. This happened last week. I'm probably still in the feed, but I'm assuming that, Mick, we lost your audio here. I'm going to kick you out and then just rejoin, okay? I still got everyone? We're going to answer that question. I'll get Mick back. I feel so lonely now. Let's give it 1 second here. Oh, hey, Sunit. Thanks for sending me that article this morning, man. I woke up to that, and without that, we would not be doing this. Dr. Sunit Gupta there, and I went to India last year and saw a bunch of patients. Great time. Mick should be joining any second here. We'll get back to that question around hiring new people. Very interesting to see markets up today. That's a whole nother topic. Obviously, really volatile time. Send a request. View. Oh man, 3 people want to be in the video. I'm just going to invite Mick for now. Pending. All right, we got you back.
Good.
Your audio likes to drop out.
It does. It does.
That's all right. So yes, it sounds like if you want to bring on this optician, that it's still going to be okay, because you'll be able, they're not worried about a new hire per se. They're just worried about kind of what was your payroll last year times 2.5, and you can use it. But the thing is if you fire that person shortly after, you will have to pay back part of this loan. If you've retained 100% of that staff, it sounds like you will be forgiven on this. All right, more questions here. Will she count my payroll even though she hasn't started? I'm doing the same as Mick in keeping people employed. Good for you. Are you having them use PTO now or letting them keep it? Mick, maybe same with sick time. I'll add that to that question.
Yeah, we are not requiring anybody to use vacation or sick time or PTO time. We've just decided as a company that we want to continue to support our folks. We don't want them to come out of this draining all the benefits that they have accrued and earned as an employee of the company.
Yep.
So at this point, we have not penalized anybody or required them to take any vacation or PTO. We just feel like it's the right thing to do.
That's the right thing to do. And if circumstances get crazier and crazier, at least that is a bucket you can tap into. I mean, you're all in it together. And once again, that goes to the thing from before of how do we just kind of spread this issue out over more people rather than one person or one business taking a massive hit. And it seems like everyone's kind of uniting to do that. Hopefully everyone gets hurt a little rather than 1 or 2 groups getting absolutely annihilated, you know?
Right.
What about 1099 employees contracted working within the practice? Yes, apparently eligibility evaluations are to be limited to whether a business had employees for whom the borrower paid salaries and payroll taxes or paid independent contractors. Okay, going back here, everyone can hear
So
us.
Matt, just so I'm clear on that one, that's a great
Yep.
question. So it did say independent contractors were included.
Yeah, Mick, I'm
Okay.
going to send this to you just so you have it, but I'll do that in a minute here. Yeah, yep, that's what it says. And by the way, I am reading this. I've been searching high and low for where to find the details of this. I am reading this off of a law firm's certified public accountant website that seems to be up on this, and they posted this. Today's the 20th. Yeah, they posted this last night based on their interpretation. I haven't seen anything better than this. We'll go ahead and post this on our resource center, covalentcareers.com/coronavirus, and you can see all these details. Thanks again, Sunit, for sending this to me. And Mick, I'll send it right to you. Did you say that you can't use the money for rent, utilities, or overhead? Well, I think, let me see here. Rent. The loan proceeds may be used to cover payroll costs, mortgage, rent, and utility payments, and the interest on other debt obligations incurred prior to February 15th. It sounds like they, you can, like, once they give you this money, think about $350 billion. It's impossible to track and audit that. Everyone is completely slammed right now. So it's pretty nice here that they're giving guidance on, hey, look, you can use this for whatever, but we're just going to measure your unemployment claims because that's a government and state-based thing. And you're going to have to pay for the interest on it if you let people go, because it's made to not line your own pockets, of course, to help your employees continue to have salary. So yes, you can use it for those things, but if you let those people go, then there will be you will have to owe money on the loan at some interest rate. My guess would be, if I had to guess, the interest rate would probably be around 4% or so. It seems to be what other interest rates are coming out at, which is still cheap money, it seems.
Yeah, and
Well,
you know,
maybe not that
the other
cheap,
thing
but
the other thing that I heard was that it would not be until a year later that you would have to actually prove, if you will, what you use the resources for. So I suspect there's going to be some document tied to our tax returns next year that will require us to evidence how we spent the money. And it might be a simple accounting form that our CPAs and tax preparers use. It just basically $50, and in the period between April 1 and June 30th, you spent $50,000 on payroll, and that may be enough to justify it. Because to your point, Matt, I don't think it would be impossible for them to really track everything. So I think the money goes in a big bucket. You spend it right now as you need it, but I think at the end of the year, you'll probably just have to prove that you use the money. You know, because we in our tax returns, we have to put our operating costs in there. And so
yes.
we just prove on our tax returns that we spent the same amount of money relative to what we got in stimulus. If there's a shortfall, then that's the part that now converts to a loan that would have to be repaid. Now, you said something interesting. If you could go back to this.
Sure.
Something about you'd be responsible, you could use the money to pay back interest on debt, but not the principal on debt?
Yeah.
Did I hear
So
that
let's
correctly?
see here. Principal. Yes. So I'm going to go into also one of the questions here, Mick, and address what you're saying. And by the way, I've got 9 minutes. I do need to jump off for a call. Loan forgiveness. Borrowers will be eligible to apply for loan forgiveness equal to the amount spent by the borrower during an 8-week period after the loan closing date on payroll cost, interest on mortgages, payments of rent, and utility payments, in each case that were in place before February 15th. So yes, it's and there's a little more on loan forgiveness. By the way, I'm having our team load this up on our Coronavirus Resource Center now, so in a second you guys will be able to get that. Principal payments of mortgages will not be eligible for forgiveness. The amount forgiven is reduced proportionally by any reduction in employees retained compared to the previous year and by the reduction in pay of any employee beyond 25% of the prior year's compensation. However, reductions in pay for employees of an annualized salary of more than $100,000 are not considered in this calculation. No principal.
Yeah,
but
that's what it sounds like.
Then again, it's interesting though, because technically if that money goes to paying off one bucket, you now have more money to put towards your principal. So it is, that's accounting, I guess. I've already applied for an SBA disaster loan as well as a business line of credit through my bank. Will these disqualify me from the new stimulus? I can almost certainly say that the business line of credit will not disqualify you, because I'm almost positive that's just a completely different bucket. Our business has a line of credit, and that just is what it is. Now, the SBA disaster loan, that's a great question, but I believe here that I read, it's so hard to find stuff in this thing. SBA relief loans under the CARES Act, it is important to note that this portion of the CARES Act is not the same as the SBA Economic Injury Disaster Loan, EIDL, loan program that is already available on the SBA website, nor may it be used for the same purpose. Instead, borrowers should evaluate both programs and choose accordingly. Got to pick one, it sounds like. And if you applied for that, I do believe that is also still a good program. how do you suggest paying yourself, and you trust that the government pays you back, and how long will it take? Well, the government won't be paying you back here. The government will be paying you. You'll receive a check when you leave the bank that day, unless I'm misinterpreting that. In terms of how do you suggest paying yourself, at times like this, if you believe in your business, I would pay yourself as little as possible, because you own that business, and therefore it will return dividends for you in the long run. So it's a time to invest, I would say. But you obviously need to put food on the plate and all that stuff. So pay yourself a small amount in order to, once again, leverage your future income earning potential. Mick, how do you address that one?
To 100% agree. I mean, this is, and I was just going to send a note to all of my team and just remind them that, there are, if you're a Dave Ramsey fan, he talks about the four walls, and the four walls are food, shelter, utilities, and transportation. And when all hell breaks loose, you want to make sure those four walls are addressed personally. And for us, that would be, our shelter, which is our mortgage. Almost every bank, in fact, Gavin Newsom in California, I heard yesterday, announced that almost all the big four lenders have programs in place to allow you to defer payment on your mortgage. So that's a big relief on the personal side. All of us have plenty of clothes. Believe me, we have more clothes than we need. We don't need to go out and buy clothes. Food is obviously a priority. Paying your electricity bill, although here in San Diego, I got a notice that there was a moratorium on shutoffs. So if you don't pay your electricity bill in San Diego, they're not going to shut your power off. I don't think the water company is going to shut your water off. So your utilities are fine. You can get a deferment on your mortgage. You don't need clothes. And really the only thing you need to do is buy food.
Yes.
And you can't go anywhere. We're all in lockdown, so you don't need your car, so you don't need to buy gas. So really, how much money do you need in a month to buy groceries for you and your family? That's really what it comes down to.
That's what I like to hear. Yeah, this is a time for savings. We will get through it, but be smart here, and you will absolutely, be able to come out on top. Just so everyone knows, go to covalentcareers.com/coronavirus. Our team has now put up this article I've been reading from. You have to scroll down just a bit, but it's under SBA loan program changes. So it's just one scroll or so. We have a bunch of great resources there, including a link to the Profitable Doctor, which Mick is our leader on and the expert on here. So much great stuff coming from him. But check out this article, and we update this multiple times a day with new items. So everything I'm reading from, you could check there. Let's take a few more.
Hey, a couple of quick comments, if
Sure.
I don't mind, if just a couple of
Go ahead.
things. One is a lot of questions this week I've gotten about Profit First. So some of you guys know that I teach the method of Profit First. So the question is like, what do I do with Profit First? And my answer is continue as business as usual. In other words, don't stop your habits of moving money into the allocated percentages into the accounts, because we don't want to break that habit. Number two is that I know that probably a lot of your followers are Vision Source practices, and I just wanted to say that tonight at 5 p.m. we're doing a nationwide webinar. Must be a Vision Source practice, but we'll have myself and an attorney on from HR for Health that will be joining us, and he's going to dig deep into the employee questions, like how do we manage the furloughs and that sort of thing. So just wanted to let everybody know about the Vision Source webinar tonight.
That's excellent, and really excited that Vision Source is doing that, and make it sounds like once the stimulus bill passes, we can kind of jump on and talk more as everything develops.
Yes.
Just a few other questions here we'll get to. Will we use the bank that we do business with? From the Treasury Secretary's announcement last night, it sounds like it will literally be that easy, although there'll probably be a line out the door. So you might have to get there early. I think it was asked already, but my office is closed and staff is at home, and I want them to be paid as if they are working 40 hours. Should I pay them normal working hours or pay extra sick PTO? Mick, that's a great question for you.
We're paying, if you worked 40 hours a week in my office, we're paying you for 40 hours even though you didn't show up this week. If you work 24 hours, you get paid for 24 hours. Whatever your normal typical pay is, that's what we're paying.
Yeah. Sunit, it's a hard one to swallow, but it sounds like that's the right call, and certainly we hope that the stimulus bill is as simple as what they're describing it to be and ends up working out. But everyone, go ahead, go to the covalentcareers.com/coronavirus where you'll find this information, a link to Mick Kling's Profit First workshop and all of that. It's really fantastic. Mick, looking forward to when we can stop social distancing and do more of this type of stuff in person. And thanks everyone for joining. Sorry we weren't able to go on Facebook with this one, but we will be going live again.
Yeah,
Best
Matt, thank you.
Thank
you for your leadership on this. You're amazing. We need folks like you to get the word out. So thanks so much.
Right back at you. Thanks everyone.
All right, bye.
Thanks, Mick. Take care, everyone. Bye.
Bye-bye.